I'm Dr. Chan, and I'm here to talk about diabetes. We all know diabetes as having high blood sugar. But before we go into that, I think it's good to know what really happens to sugar as soon as we take it into our body. Sugar, also known as glucose, serves as the main energy source of our body. It is like the workers that makes the vital organs of our body, such as our brain, heart, and muscle, function. We get glucose from the common food that we eat that contains carbohydrates. Soon as we take in glucose, our body sends signal to our pancreas to secrete insulin. Insulin serves as our worker's ride in order to get to the vital organs. High blood sugar happens when there is not enough insulin or the insulin in our body is not working as it should. When we have high blood sugar, our body takes in the excess water, making our body in a state of dehydration. When we're dehydrated, nutrients cannot reach the vital organs. Our body then tries to get other source of nutrients, which is from the muscle. And when this happens, our body secretes what is called ketones. When our body is dehydrated, having high blood sugar, and producing ketones, we feel symptoms such as frequent urination, frequent thirst, frequent hunger, and in the more advanced stage, abdominal pain, vomiting, and even coma. When you see these symptoms in your child, bring them to your pediatrician and have them checked out for possible diabetes, because these are the common symptoms we see in children or even adults with diabetes. Now, there are two types of diabetes. What we are probably more familiar with is type 2 diabetes. Type 2 diabetes is diagnosed in adults, adolescents, and now sometimes even children. Type 2 diabetes happens when we take in a lot of glucose than our body can handle. When this happens, our body tries to secrete more insulin in order to match the sugar overload. Unfortunately, excess glucose is converted into fat, and fat makes the insulin not work as it should, meaning the insulin is just not seeing this excess glucose that we take in. Which is why diet and exercise is very important in the management and even prevention of type 2 diabetes. Diet to help limit the glucose intake, and exercise to help break down the fat that already has built up. A lot of times, doctors will also prescribe a medicine called metformin in order to help the non-working insulin work again. If the blood sugar is just too high, doctors will also prescribe what we call insulin in order to help control the blood sugar and prevent complication. And that is type 2 diabetes. Type 1 diabetes happens when there's just no insulin in the body and nothing to control the blood sugar. This usually happens because the body for some reason develops antibodies that attacks the cells in the pancreas that secretes insulin. Unlike type 2 diabetes, it is not because of diet, and it cannot be managed by diet and exercise alone. This type of diabetes is usually diagnosed in children, toddlers, and sometimes even infants. Treatment is really just giving the body what your body is not making, which is insulin. Parents usually have to work very close with their pediatric endocrinologist in order to match the insulin requirement of their growing child. That basically sums up what diabetes is, how it develops, symptoms to watch out, the two types of diabetes, and how they're usually managed.
Hello, my name is Ruth Melgoza Walker. I am a registered nurse, certified diabetes educator with the Pediatric Endocrinology team. In honor of November 14th, we celebrate Diabetes Awareness Month. Today, I would like to discuss a couple of topics: self-glucose monitoring, how to treat hypoglycemia, hyperglycemia. Diabetes is a very complex condition that requires daily self-management, making decisions with diet, exercise, monitoring blood sugars, taking medication like pills and insulin. It is also important that you talk regularly with your diabetes team and doctor to problem solve and reduce long or short-term complications, and also to cope with lifestyle changes. Some of the most important problem-solving skills for people with diabetes are learning how to recognize and react with high and low blood sugars on a daily basis, learning how to manage also sick day guidelines. Let's meet the meters. Here we have an example of our brand name meters that are offered by private insurance and most public aid medical insurance. They vary from $10 to $300. You might need to consider asking your diabetes certified educator or your provider to match the meter to your lifestyle and your budget. You might also consider the test strips, the lancets, which vary in price as well. The meter might cost $300, but your strips can vary from $2 to $5. Your lancets as well, from 50 cents to $1 each. This is something you might need to consider if the child is testing once or twice a day to 6 to 8 times a day if the child is on an insulin pump. The replacement of supplies is considered also by your insurance. Some private insurance might cover some of the supplies. Another option to consider is the continuous glucose device, and that is a tiny device that is inserted into the abdomen or the arm to regulate and regulate blood sugars on a continuous basis. The transmitter is attached and it signals off wireless information into an iCloud. That information is then transmitted into a handheld receiver that displays current blood sugars on a continuous basis and a graph of blood sugars that informs the loved one and also the parent of how the blood sugar is trending too high or too low. This is a definitely clue and updated technology. Some insurance cover the device, others do not. Let me show you how to use the meter. So before you start, you want to have your equipment available. You have your meter, you have your strips, you have your lancet device, and your lancets. We recommend you wash your hands with soap and water before you start testing. If you don't wash your hands, there might be dirt or residue or lotion that may alter the blood sugar result. So what you want to do is you want to open the top of your container, and it pops because it wants to remind you that you can leave it open and your strips can be damaged, and there goes all of your strips, which could be very expensive. So you want to insert your strip into your device, and then your device will tell you it needs a drop of blood. You take your lancet device, you untwist the top, you insert the lancet, you rotate it a couple of times. You want to keep that because we're going to use it in a little bit. You add your top back on, you cock it, and then you want to press the button. Oh, I forgot to mention, you need to set the depth of the needle. So once you're done, you press and you stick your finger. You press down. Once you have your blood drop, you want to aim the strip close to your blood. You wait a couple seconds and you get a reading, 88. We will discuss what the range of blood sugars are in a few minutes. You want to remove the strip and deposit it in a biohazard container. If you don't have a biohazard container, you might have an empty bleach bottle, a softener container, or a laundry detergent container. They are very strong plastic, and just in case, the needles might not be able to penetrate right through. So you want to remove the top of your lancet device, use the old top, kind of insert it back in, and then gently pull it out and also deposit it on your biohazard container. Now, the next step is documenting your blood sugar results. It is essential that you write the blood sugars because A, you're not going to remember, but most of all, it gives us a blood sugar pattern. When you bring it to your doctor will be able to determine if blood sugars need to be adjusted through a new insulin adjustment plan. It also gives us a picture of the blood sugar daily activity and where we can adjust insulin either in the morning, afternoon, after or before physical activity. Let's talk about diabetes blood sugar management. With diabetes, you have a fluctuation of high blood sugars and low blood sugars. And therefore, that's the reason for monitoring your blood sugar so that you know the accurate number. Now, blood sugars can be low, and we'll talk about that. First, I want to talk about high blood sugars and the reasons for high blood sugars. Let's talk about high blood sugar basics. Hyperglycemia has symptoms. Some children have their extreme thirst and therefore want to urinate, so urination frequency. Some complain of dry skin, blurry vision, fluctuation of hunger all the time, very drowsy, sleepy, and then the healing process is very slow. You need to talk to your doctor about these signs and symptoms. Here at our team, we say high blood sugars are greater than 250 on your meter and symptoms, you need to call us. Again, symptoms vary from urination frequency, feeling drowsy and tired, extreme hunger, very thirsty, and blurred vision. What are the causes for this? Well, for some children, it is inaccurate carb counting, missing shots, there might be a need for insulin change, illness, and poor rotation site. Some children keep injecting themselves either in the upper arms or in the stomach, and they don't rotate. The treatment for high blood sugars are increased in insulin corrections, increase in fluid, clear fluids, and also giving insulin corrections. There is a guide that we supply, and we call it the SIG guide management, where if the child has 250 milligrams per deciliter of blood sugar in the meter, we require that they drink fluids. Mom or dad gives a correction. They need to check for urine ketones. If the ketones are high to moderate, the child needs to be monitored every hour and given insulin for management. So here's a ketone box. Ketones are found in the body, in the urine, when there is a lot of acid built up. When the child has missed an insulin dose or doses, some children miss their Lantus, and if they're type 1, they're at risk for acid buildup, known as ketoacidosis. One of the ways to measure that is by checking the urine. It is important that they urinate or they dip the stick into the urine. After it is dipped, you wait 20 seconds, and then you're going to compare your strip with the graph here. If the strip is negative, that means no ketone development. Trace to small, we recommend you drink water. And also, as it starts to get to moderate to large, that's when the child is leading to diabetic ketoacidosis. So the child will need to drink more fluids, needs insulin correction. Once the child is more sleepy, having difficulty breathing, they need to call the doctor for more medical advice. Let's talk about the basics of treating a low blood sugar. What are the causes of low blood sugars? Well, there's many causes. Usually for children is unusual exercise, maybe injecting insulin into the muscle, carb counting errors, or corrections that are miscalculated, missing foods, illness, the honeymoon phase, medication that contain alcohol, or if they're taking a hot tub or bath after taking insulin. Let's talk about preventing a low blood sugar. Once the child or young person exhibits shakiness, fast heart rate, sweating, dizziness, anxious, maybe hunger, blurry vision, fatigue, headaches, and irritability, the child or young person is required to check the blood sugar. Low blood sugars are considered once the blood sugar is less than 70 deciliters per milliliter. What to do? The treatment is, we call it the 15-minute rule, which requires 15 grams of fast-acting carb. Liquid is preferred. Normally, we recommend a half a cup of juice, half a cup of pop. Anything that's liquid will work much faster than a solid. The other thing that we recommend is to carry 3 peppermint candies or tablets or gels. If the child is less than 7, you want to provide them with something rapid, like a gel. Frosting cake is also a good method. So you wait 15 minutes. You want to recheck again the blood sugar until the blood sugar rises above 80. You want to do it every 15 minutes. After 45 minutes, if the blood sugar has not raised up to 80, you want to give them a fast source of carbohydrate like a protein and bread. So maybe a half a bread, peanut butter sandwich, or a ham sandwich with lettuce, tomato, and cheese. Sometimes if you don't have that access, a cheese stick or some nuts available would be a great source. The blood sugar should rise above 80. You have to go back and think what caused that blood sugar to prevent that from happening again. Let's talk about how to treat a severe low blood sugar. A severe low blood sugar is when the child is unconscious, may or may not have a seizure, and also not recommended that the child eat or drink because the fear of choking. Glucagon needs to be administered, and glucagon is inserted by a syringe. This needs to be, however, prepared. It comes in a kit. Let me show you how to use it. You pop the top open. You insert the liquid into the vial. You rotate it until you mix it and it's clear. You want to draw the solution. If the child is less than 5 years old, you want to give half the amount. Over 5, you want to insert the whole medication. You want to inject it on the child's thigh, and then you want to rotate the child's face to the side because this may make the child vomit. You want to call 911 for emergency help. The child needs medical attention at this time. The child is also recommended they carry a medical alerts tag for assistance when the child is not with the parent, when the child's at school, at other school events or outings with friends, so that the child can have immediate attention and the person knows how to treat a high or a severe low. This ends my presentation. I hope that you found this information on how to treat hyperglycemia, hypoglycemia, and how to check your blood sugar regularly. We hope that you found this information helpful. If you need any further assistance, please feel free to call 312-996-1795 to schedule an appointment so that we can assist you in diabetes management. Thank you.
National Diabetes Month 2016. My name is Marla Solomon. I'm a registered dietitian and a certified diabetes educator. We're going to talk about diabetes today. If you have diabetes, please monitor your blood sugars and control it. But if you don't have diabetes, we can prevent it. And that's what I'm going to talk about today. Preventing type 2 diabetes. When it comes to type 2 diabetes, it's the insulin hormone, which is in our body. It's like Pac-Man, as I all tell the kids. The Pac-Man, or the insulin hormone, picks up the sugar from our blood and takes it to all the body parts so that we have energy. But there's times when that insulin hormone doesn't work, and that's when type 2 diabetes results. Let me tell you what we can do to prevent it. There was a study that started in 1994 called Diabetes Prevention Program, DPP. Can you believe it? The study is still going on. It's older than most of the kids that I see in the clinic. We learned from that there are different risk factors when it comes to type 2 diabetes. So that if we are aware of these risk factors and we take care of them, there's a bigger chance that we will prevent this chronic disease. But let's think about it. I hope all you parents, just like you're bringing your kids to one of their providers or doctors, I hope you too are also seeing a doctor, because your family history will be an important aspect for your doctor to know to prevent this disease. So the risk factors, what we learned, are being overweight, that's poor nutrition, and also lack of physical activity. Also, family history, as I was talking about, a family history of type 2 diabetes. And lastly, certain racial groups like African American and Latino cause a higher risk for developing the type 2 diabetes. So again, it's poor nutrition and exercise, family history of type 2 diabetes, and also certain groups have a higher risk. Let's first talk about the nutrition aspect. When you come to the clinic, your doctor is going to be looking at the height and the weight. That's the obesity aspect, making sure that your child is not going overboard. And how do we make sure that they don't ever get to the stage of overweight or obesity? Or even if they are at that stage, what can we do? We as parents need to reflect on being a good role model. I always say to the parents, your actions are stronger than your words. Your actions are stronger than your words. So I hope that you are also having 3 meals a day with a variety of food groups. We have the protein, the vegetable, and the grain group all on one plate. So a variety of food groups is really important. Another important aspect is family meal times. You know, we grew up with family meal times, but a lot of us are not having family meal times with our own children. During these family meal times is when we can talk, when we can observe all about food and all about eating. And also learn about what else is going on in our children's lives, all around the dining table. Another aspect that we need to look at is snacking. What are our kids snacking? Well, with snacking, I like to bring up some fun snacking ideas that your child, I don't care if they're 2 years old or if they're 20 years old, they can all participate. A snack that I'd like to share with you is the fruit kebabs along with yogurt dip. What I have here is a bountiful of different colors. You know, I always like to see a plate that has a rainbow of colors. The more rainbow of colors on that plate, the more different nutrients are going to be consumed. What we have in this recipe are cut up pineapples, strawberries, blackberries, and clementines or oranges. And what we're doing is taking a skewer and threading them through. And again, it's so much fun to work with the kids so that they have a chance When the kids make something, there's more of a chance that they're going to consume that item. Let's get on the blackberry. And let's get on the oranges or the clementines. And then we'll repeat it. Okay. Another blackberry. Okay. And a strawberry. Now isn't that pretty? Okay. I would say that's good enough to eat. Now, with all the different vitamins and minerals that are in the fruit, we can add a yogurt dip that has calcium, and we've added some flavor by pureeing strawberries, adding that to the yogurt, along with a tinge of honey, which we may not need because the strawberries will be sweet enough, and some vanilla. But you'll see on our screen that we do have the recipe for you to enjoy and make it with your child. All right? So snacking, family meal times, and being a good role model is so important for our kids to obtain or maintain healthy weight. Another aspect when it comes to the diabetes prevention program is exercise. Again, family exercise. I think I'm repeating the message that family needs to be involved. What the diabetes prevention program recommends is 5 times a week for 30 minutes. Remember when I talked about the insulin hormone? That exercise is going to help that insulin work more efficiently of controlling the blood sugars. So 5 times a week for 30 minutes. Now the American Academy of Pediatrics recommends on most days that we need to get in 60 minutes. And you know what? You can divide the 60 minutes up, but 60 minutes on most days. So exercise and healthy weight are 2 factors that we can do in order to prevent type 2 diabetes. But let me share other things that we have with the Pediatric Endocrinology Department at the University of Illinois. Other services are meeting with a dietitian to develop a meal plan, and also 3 to 4 times a year we have a family lifestyle class. It's an 8-week class that incorporates fun activities for the kids as well as important discussions for the adults. Please, if you need further information, don't hesitate to call the Pediatric Endocrinology Department at 312-996-1795 for further information. But be aware that you and your family can prevent diabetes, and you can do it. Thank you.
Hola, me llamo Ruth Melgoza Walker, soy enfermera educadora de la diabetes. Hoy voy a hablar con ustedes sobre la diabetes. Noviembre es el mes de reconocimiento de la diabetes. Estoy aquí para darles un breve ejemplo de mantenimiento de la diabetes con el monitoreo y el tratamiento y las causas de azúcar alta, que le decimos hiperglicemia, la azúcar bajo, hipoglicemia. La diabetes es una condición y enfermedad que se necesita mantenimiento diariamente con ejercicio, dieta, monitoreándose los niveles de azúcar, tomando medicamentos, pastillas o insulina. Es muy importante que usted hable con su médico o educadora de diabetes para poder resolver los problemas, los riesgos de complicaciones que le decimos acute, que puede pasar rápido, o larga, que le decimos long term. Y también para poder ayudarles con el mantenimiento de cómo acoplar con la condición de la diabetes. Uno de los más importantes problemas que gente tiene con el mantenimiento de la diabetes es aprender de reconocer y reducir los niveles de azúcares altas y bajas. Hoy les voy a dar un breve mensaje o explicación cómo usar el monitoreo y cómo poder controlar los niveles de azúcar altas y bajas. Vamos a reconocer uno de los monitoreos de sangre que tenemos aquí. Sepa que los monitoreos cuestan de diferente precio, de $10 a $300 de precio. Por favor, considere su doctor o su educadora de diabetes para poder darle un monitoreo que sea para su estilo de vida y su costo financiero. No nomás mire el monitoreo porque es el nuevo fama del tiempo. Tiene que considerar las tiritas. Las tiritas le pueden costar $1 hasta $5 por tirita. Esto es lo que cuesta más para unas personas. Segundo, la lanceta también es otro costo que tiene que hacer. Déjeme decirle que la tirita puede ser que la va a usar el joven 1 o 2 veces al día, hasta 6 a 8 veces al día si la joven está en una pompita de insulina. Las aseguranzas normalmente cobran el costo del equipo que el joven va a usar. Muchas de las aseguranzas le va a decir cuál es el monitoreo de preferencia. Las aseguranzas privadas también ofrecen las tiritas y las lancetas. Puede ser que su aseguranza le da 100 tiritas o 200 tiritas. El resto lo va a tener que cubrir de su bolsa. Ahora, no tengo aquí, pero hay otro producto que se llama CGM. Consiste en un glucosa monitoreo que consistentemente está tomando el level de sangre por un transmitter que le decimos. Ese transmitter está insertado en el abdomen o en el brazo y le va a estar dando el level de sangre consistentemente por un, le decimos un electrónico wireless, y se va a una nube. El padre va a recibir esa información o el joven por un electrónico y allí va a estar automáticamente dando el level de azúcar altas o bajas. Este producto se llama CGM y está programado por nosotros. Va a necesitar que tener una cita. También muchas de las aseguranzas no lo ofrecen, pero las aseguranzas privadas sí. Y esto le da mejor resultado de los niveles de azúcar altos y bajos. Es un buen equipo de tecnología que tenemos. Déjeme enseñarle cómo usar el monitoreo. Voy a usar este. Va a necesitar que tener su monitoreo, sus tiritas que vienen en este frasquecito, su equipo de las lancetas. Va a necesitar que sacar la tirita de su frasquecito, meterla en su máquina, donde la máquina le va a tener su tiempo y día de fecha. Saca su lanceta, se la encaja, la va a voltear 2 o 3 veces, le va a poner su tapita, le va a encajar para atrás y entonces también va a tener que ponerle el cambio de qué fuerte va a querer que le penetre a la piel. Le recomiendo 3. En esto entonces le va a poner su dedo, le va a premar el botón y le va a dar la sangre. Recomiendo también que va a usar los dedos del lado de los dedos. Nunca trate de picarse en la cara de los dedos. Otras máquinas también ofrecen que se pique en los lados de la mano o aquí en la muñeca del brazo. Cuando ya tiene su sangre, su máquina le va a decir cuando necesita la sangre, le va a demostrar con gotitas. Aquí está 91. Que documente el level de sangre porque esta información es importante para su doctor. Le dice cuándo va a necesitar aumento de insulina o si está baja o alta. Va a remover su tirita y la va a poner en un bote donde está fuerte. Quite su lanceta y la encaja. Ahora, muchas casas no tienen los frascos que le decimos biohazard. Recomendamos, por ejemplo, tener un bote de cloro, dejertante o suavizante. Va a meter sus tiritas, todas sus piquetes para que no se dañen otra gente. Le va a poner un duct tape, le decimos, y lo tira en su basura. Vamos a hablar de los niveles altos de azúcar. Una breve explicación. Cuando el nivel de azúcar está más de 250 en su maquinita, estamos necesitando intervenir. Primero vamos a saber qué son los síntomas del azúcar alta, hiperglicemia. Muchos jóvenes toman mucha agua, van al baño frecuentemente, se quejan que tienen la piel seca, miran borroso, tienen mucha hambre, se sienten con mucho sueño, flojos, y también el cambio de carácter cambia. Muchas veces con los niveles de azúcar altos, la piel o si tienen herida no se sana, si tienen una enfermedad, pues duran más para alivio. Vamos a hablar del tratamiento. El tratamiento de la azúcar alta es cuando el joven tiene la sangre más de 250, va a necesitar que reponer líquido sin azúcar, líquidos claros como agua, va a necesitar correcciones de insulina, revisar las ketonas en la orina y también a lo mejor llamar a su médico para otra información médica. Vamos a considerar las causas para poder prevenir este caso. Puede ser que las correcciones de carbohidratos se equivocaron, no se dieron insulina, se les olvidó las lantas o comieron y no se dieron insulina. O también la enfermedad, el estrés o si están cambiando al estado de desarrollo. También los jóvenes o niños no se cambian de rotación de insulina. Es importante que el joven tenga mucha atención, supervisión de adulto. Vamos a hablar de las ketonas. ¿Qué son ketonas? Bueno, las ketonas se hallan cuando el nivel de azúcar está más de 250 y la orina se necesita que esté revisada. Se revisa con tirita y la va a comparar con el frasco. Va, por ejemplo, agarrar la tirita y la orina. Después de 20 segundos va a comparar el nivel de tirita con retrato. Cuando hay mucha ketona, va a salir aquí. La va a comparar. Por ejemplo, aquí vamos a decir que está más o menos está alto, está moderate, le decimos a alto. Cuando ya está aquí, decimos que la joven perdió o no se dio insulina, va a necesitar líquido, va a necesitar una corrección y muchas veces recomendamos que llamen a nuestro servicio para más asistente. Lo que va a hacer la padre es darle líquido, corrección de insulina y estar frecuentemente 1 hora o 2 horas revisándole el azúcar de la sangre para ver qué es el otro paso. Recomendamos, si necesita más ayuda, que llame al doctor. Hoy vamos a hablar de las causas del nivel de azúcar bajo. ¿Qué son las causas de la azúcar baja? Hipoglicemia. Las causas son enfermedad, se les olvida tomar la insulina, exceso de actividad que normalmente no hace, no comen a tiempo, medicamento que contiene alcohol como las medicinas de tos, si se bañan con agua caliente, después de darse insulina. Los síntomas de baja azúcar, de hipoglicemia, pasan rápido. Puede sentirse tembloroso, siente que el corazón le está palpiteando muy rápido, mareado, ansioso, cambian de personalidad, miran borroso, se sienten débil, dolor de cabeza, muy irritable. Les recomiendo que se revisen la sangre. La sangre va a indicar que está menos de 70. Cuando llega a 70 ya vamos a necesitar el tratamiento de tomar jugo, tomar líquido como soda. Recomendamos que tome mitad de vaso de soda, ¿verdad? Sabemos que el líquido sube el nivel de azúcar más rápido que algo duro como dulce. Cargue dulces o tabletas para el tratamiento de azúcar baja. Va a revisar la sangre cada 15 minutos hasta que suba el nivel de sangre a 80. Si después de 45 minutos no sube el nivel de azúcar, se recomienda que coma mitad de sándwich o un taco que contenga carbohidrato, la tortilla o el pan, la carne, la proteína. Después de 45 minutos, después de comer un breve, vamos a hablar sobre los básicos del tratamiento de hipoglicemia. Hipoglicemia es cuando el nivel de azúcar está menos de 70. Muchos de los síntomas son rápidos, incluyen se siente tembloroso, mira borroso, está sudando el joven, el carácter cambia, se pone ansioso, nervioso, dolor de cabeza, irritable. A veces muchos niños miran borroso, como dije, y les da mucha hambre. Recomiendo que se revisen el nivel de sangre y le va a decir que está menos de 70. A ese momento el joven necesita líquido rápido, necesita mitad de taza de jugo o mitad de soda. Líquido es recomendable porque sube el azúcar rápido. Después de 15 minutos se repite hasta que el azúcar esté más alto de 80 de nivel. Ahora, para el tratamiento de un azúcar gravemente baja, menos de 50, vamos a decir, la persona puede perder conciencia y no puede tomar nada de líquido porque se puede ahogar. Recomendamos que use el tratamiento de la glucagon. La glucagon es un medicamento que le dice al páncreas que escupe azúcar para poder traerle el nivel de azúcar al cerebro. Esto se necesita que mixtear, viene en un kit, le decimos. Por favor, mire cuándo se expira el medicamento. Normalmente dura 1 año y es muy cara. La medicina viene en polvo y viene en líquido ya preparada. Lo va a inyectar y va a mixtear el líquido con el polvo hasta que esté claro. Va a sacar el medicamento. Va a dar todo el medicamento si el joven tiene más de 5 años. Se lo va a encajar de la pierna. Después de darlo, va a voltear el joven de lado. El síntoma secundario de la glucagon es vómito. Queremos que lo tenga de lado para que no se ahoga. A este momento va a pedir ayuda, va a marcar a 911 para asistencia médica. Se queda con el joven hasta que venga la ambulancia. Muchas veces con la diabetes recomendamos que traiga una brazaleta de identificación que tenga la diabetes para poder darle al joven el tratamiento apropiado, si es baja o si es alta. Les quiero dar muchas gracias por atender esta breve explicación de monitoreo y de azúcares altas y bajas y las causas y tratamiento. Les invito que llamen a 312-996-1795 para una cita para poder entender el mantenimiento de la diabetes. Tenemos más clases en inglés y en español. Gracias por su atención.